Good evening, everyone. Thank you for joining us. We're going to wait like one more minute to allow people to load in, and we're going to get started with Mental Health is a Serious Matter, Session 2, Mental Health 101. Okay, good evening, everyone. Thank you for joining us. We're going to go ahead and get started. I am going to start with introducing myself, and then welcoming you, and then we'll just go ahead and jump into the materials. I want to first say greetings on behalf of Xi Zeta Omega chapter of Alpha Kappa Alpha Sorority Incorporated. And on behalf of our president, Courtney Coffey, we welcome you to our event tonight. My name is Nicole Jones, and I am the event chair for this event. Mental health is a serious matter, which started in Mental Health Month, which is in May. And we thought it would be important to talk about some of the issues that we don't talk about in our communities related to mental health. And so we started this journey with our first segment, which really focused on the need for mental health support. And now we want to give you more information. So this segment is going to be talking about mental health 101, mental health conditions and disorders. And so let us jump in. I'm going to get started and start talking about this material. I'll share a little bit. We had a speaker that was scheduled for tonight, but there was a bit of a couple of conflicts. And so I'm bringing this information to you. I am myself a mental health provider, giving you a little bit of details about my experience. I've been working in the fields of mental health and substance abuse for 25 years. Currently, I am the suicide prevention coordinator at the VA Maryland Healthcare System, and I work with veterans and veteran family members related to suicide prevention. But mental health and substance abuse has been a foundation for my career. And so I wanted to make sure that we didn't miss an opportunity to share this information. So I will be your presenter this evening. And so I'm going to start by talking a little bit about, let's see, I'm going to make sure I can, my slides. There we go. All right, a little bit of a disclaimer. This evening, we're only giving this information for educational purposes. This is not for self-diagnosis. We just want people to know what information is important to know about mental health in order to, number one, evaluate whether you yourself need support or whether family members that you have may be in need of that support. And so we just want you to take this information and consider it when meeting with your doctor, talking to other mental health providers, just so that you have some information. Excuse me, but we do encourage you to continue to educate yourself. If there are conditions that we talk about tonight that you want to get more information, you should Google it. You should look on resources like the National Alliance for Mental Health. They have lots of information. But again, this is just for educational purposes. Also, this presentation is a general description of these mental health issues. So it might not be completely inclusive of all of the symptoms that you might struggle with if you have some of these conditions. But again, this is just to let you know what to, what things to look out for. And with this information, be armed to ask more questions. And then lastly, if you are concerned about yourself or a loved one, it's important to see a medical or mental health professional for an evaluation. Again, this is just information to help you know that you may need to see a professional. All right. So we thought it would be important to talk about some of the major categories of under mental health and substance abuse, basically. And we're going to talk about these topics here: mood disorders, which are the majority of what people struggle with, anxiety disorders. We're going to talk about psychotic disorders. We're going to briefly touch on substance use and dependence disorders. And then some special mentions to eating disorders, adjustment disorders, and just a little bit, very little, about dementia and how it can look like a mental health issue when someone is struggling with dementia. So moving into mood disorders. So when we're talking about mood disorders, it's a category of mental health issues that really deal with an altered mood. And again, brief description: seasonal affective disorder. And a lot of people use that acronym and it reminds you of what it feels like. Just someone that may be feeling sad, and it's related to the season. So maybe in the winter months, some people do struggle with their mood in those months. And it may be that every winter they have this drop in their energy. They have depressive symptoms. But then when the season changes, they may resolve. And so that's seasonal affective disorder. And there are some specific treatments that are good for seasonal affective disorder. Even though we're not talking necessarily about treatment modalities today, there is a treatment called light treatment. And it's a light box that during those winter months, someone can actually have a light box. You plug it in, you sit in front of it for about 15 minutes, and that light really does affect your mood. Having access to light can really improve your mood. Major depressive disorder, that's really when someone has had episodes of depression, maybe 2 or 3 episodes of depression, and it's something that they struggle with, have struggled with. Maybe they've had one episode of depression, but the severity is where you can be diagnosed with major depressive disorder. So you may have the symptoms and you have them for a certain duration of time. And it's usually any more than 2 weeks is where you really want to consult with your provider. And I'll talk a little more about those symptoms of depression, but major depressive disorder is where you've had some significant symptoms of depression for a significant period of time, and they affect your functioning. Dysthymia is where someone may have that depression, but it's chronic. They may have had it like a mid-range depression for many years. And so it isn't necessarily that it gets really bad, but at the same time, it's just chronic. They have it a lot of the time. And so that's how dysthymia is classified. And bipolar disorder, we're going to talk a little more about that. I'm going to go to another slide to give you more information. But there's a bipolar 1, which is the most common type, and a bipolar 2. So I'm going to talk, this is about the symptoms of depression. These are the things that if you recognize that, you may have an issue related to your mood. And it may start with reduced energy, someone having loss of interest in things that they used to enjoy, or just not feeling enjoyment with any of their activities that maybe used to. Reduced concentration, having a hard time focusing, disturbed sleep. Maybe they're having not enough sleep, or even too much sleep could be a symptom of depression. Diminished appetite or increased appetite as well. Everyone's different. And so some people may overeat when they're feeling depressed, or medicate with food. And so overeating might be a symptom for that person. Losing or gaining weight. Feelings of hopelessness. And as I said before, having multiple episodes in your lifetime of this depression can really, help move. Maybe someone had an episode when they were a young person, and then as they got older, they had another episode. It may prompt their provider to look at whether they have a major depressive disorder, which means they really want to consistently look at minding their mental health, and maybe even pursuing multiple treatment modalities, maybe talk therapy and maybe medication. So let's go to bipolar. So bipolar disorder is a mixture of depression and what we call mania, which is a high mood or euphoric mood. And what happens is people kind of sway between one side and the other. And, sometimes in that high mood or euphoric mood, they may be very energetic and need less sleep. Well, they need the sleep, they just don't require it, they don't take it. And they're very energetic. They may have rapid speech and thought. So they may talk fast, and they may be thinking about different things all at once. They may be restless, moving around really quickly, having difficulty focusing, or kind of pulling it in. And oftentimes people they spend excessively. So maybe they bought a new car, or made a big purchase without communicating with their family, or really couldn't afford it. And then they have this heightened sense of self-importance. Like oftentimes when people are in the midst of a bipolar episode, they may say, I want to go talk to the president, and may feel like they have a right to go knock on the White House door and talk with our leaders, because they have this heightened sense of self-importance, and also a heightened sense of fearlessness, which can be dangerous. And bipolar 2, which is less common, is where people have the mania, but it is not it's not as pronounced as when they're having a bipolar 1 disorder. So it's maybe where someone has some episodes of mania, but not to the degree of the bipolar 1. So now we're going to move into some anxiety disorders. And I'm going to start this time with the symptoms of anxiety. And what people say is it feels like you're in that flight or fight feeling, where you are anxious and you either want to run, or you want to, put your dukes up, because you feel like there's something happening and you're afraid. It can also have restlessness. You can have muscle tension. People can feel really tense. Their muscles get really tense when they have symptoms of anxiety. And that's why exercise is really good for, in particular, anxiety, but really all of the mental health issues, because that muscle tension is where sometimes that emotion gets stuck in your muscles. And so having participating in exercises where you're relaxing that or stretching that tension out can be helpful. Shortness of breath. A lot of times people who are anxious start breathing really heavy. They have heart palpitations. And so they feel like their chest is beating, their heart is beating outside of their chest or through their chest. Headaches, stomach aches. A lot of the symptoms of anxiety can mimic physical um, issues, because that anxiety is really coming through physically, because your body is in this flight or fight mode. They may have difficulty concentrating. They may feel very nervous, like that feeling of, stomach butterflies or just queasiness. But they feel that all the time, and sometimes without any provocation, no reason, nothing to feel anxious about, but they have those emotions. And also, they may feel sweaty. They may feel clammy, because just like in real nervousness, they don't know why their body's expressing it, but your body is in that mode of it's very fearful, it's very anxious, and it's producing sweat as a result. And also excessive worrying. So those are some of the symptoms that people might experience with anxiety. And then there's a cluster of anxiety disorders. And I'm not going to go into all of them, but just kind of briefly, generalized anxiety is maybe there's no real precipitating factor, or, they haven't actually, determined what type of anxiety it is, or maybe it just doesn't fit any of those categories. It may be generalized. Panic disorder can be, it could be marked with panic attacks. If you've worked with people who have had mental health issues, sometimes they experience panic attacks with anxiety. And it's just a real intense moment where their body is reacting to the anxiety that they're feeling, and it's coming out in their body. And it feels really like, a lot of people say it feels like they're having a heart attack. I've had clients actually call 911 and gather their family because they really felt that they were having a medical emergency. And so it's important to be aware of that, especially if someone that is struggling with panic disorder or types of anxiety, to know that they could be experiencing a panic attack. Specific phobias. There are all type of phobias. Arachnophobia is one that comes to mind, where people have and when I say an unrealistic fear, I have fear of spiders, but literally someone that has a phobia will walk through fire to get away from spiders. And so it's a really unrealistic or irrational fear of a specific thing. And phobias they're vast phobias. It could be anything. Some people may be fearful of plastic or aluminum foil. It could be very irrational. Social anxiety is folks that are actually anxious in social settings. They may not have anxiety when they're at home and they're in their comfort of their home with their loved ones, but when they go to school, or excuse me, or if they go to work, they may feel very anxious and unable to cope in those social settings. And agoraphobia is one that we know of. That's a specific phobia, but it's a fear of heights. And so there are all kinds of different fears and phobias. And then we talk a little bit about post-traumatic stress disorder. And I know we talk a lot about this when it comes to our veterans, but one thing I want people to know is that we can all experience trauma, and that post-traumatic stress and stress-related symptoms can affect us all with everyday experiences that we just don't realize can be traumatic. And I'll talk a little more about that in the next slide. And OCD, which is a type of anxiety disorder, which really, the thing about OCD is that it actually is a cycle where you are having obsessive thoughts. The O kind of is the obsessive thoughts, the compulsive behavior. So maybe you start with the obsessive thoughts, and it could be related to anything. But then you connect that obsessive thought with a compulsive behavior. So maybe someone is concerned about people in their neighborhood. I'll just say that, but what that obsessive thought does is it requires them to, maybe they lock their door. And every 5 minutes, because they're anxious about people in their neighborhood, they go back to locking their door. And it becomes obsessive, where they know they just locked the door, but actually going back and locking it again and making sure it's locked gives them temporary relief. And so what happens, they continue in this unfortunate cycle. Some people can't even leave the home for maybe a medical appointment because they get so obsessed with the door locking. Maybe they're on the outside, they're leaving the home and they want to make sure it's locked, and they get a mile down the road and then they actually come back because they're afraid they didn't lock it. So those are the ways in which OCD can really affect not only your functioning, but it can really hinder you, paralyze you in a sense where you can't do anything else, don't feel like you can do anything else. And body dysmorphic disorder, it's fairly new. We're talking about it more because I think it's very important. It's an anxiety disorder, but it's very much related to how you see your body and how you look at your body. And that's really big. And I really think about African American women, and not judging, because I think that people have the right to do whatever they want. But sometimes you think about the danger that some women have put themselves in, and their health danger they put their health in order to have a certain body. And so that's really kind of connected. If you think about like the cases where women injected tire inflator protect, I don't know what the name of this stuff is, but tire fix a flat into their bodies in order to produce a voluptuous figure. That would be a type of body dysmorphic disorder. But you can also see there are some men who actually want muscles so bad that they take supplements, they work out really, extraneously, and they really damage their body in order to have this perfect look, which is, it's just a dysmorphic idea about their body. Okay, so now let's talk about PTSD, post-traumatic stress disorder. And as I said, we talk a lot about it as it relates to veterans and combat. But I want to say this circle at the top talks about, I just kind of noted some of the things that can happen that can produce a trauma response, a car accident. These are things that we all have experienced. Maybe being assaulted, combat experience, of course, but even a refugee or someone who's from another country coming here for the first time, their experience can be traumatic. Seeing someone who is dead, actually seeing someone get shot, sexual or physical abuse or sex trafficking experience, all of these things can produce trauma. And so I always tell people it doesn't have to be this major thing like 9/11, or, you were in combat in a war. It can be something very simple that happens right outside your front door or even inside your home. And what happens is it produces this reaction. Your body and your mind are fearful of this trauma happening again. And so you may react in fear. You may have an inability to trust in environments where usually people feel trustworthy. You may have hypervigilance. I always say this, my husband is an Army veteran, and whenever we would go out to eat when we first dated, I was always wondering why he always needed to sit with his facing the door instead of his back to the door. And it was because he always felt like he needed to be prepared for any danger. And that's what hypervigilance will do. That person is on alert. Everyone else may be enjoying a nice concert in a field, but that person who's had some trauma experiences may be sitting there thinking about all the ways that something bad can happen. And that hypervigilance can really affect their functioning. Impulsivity, they can have a lack of empathy. And it's not because they don't care, it's because, unfortunately, that trauma has, for them, created this environment where they feel it's unsafe to be vulnerable. And so they either become numb or they want to be numb so that they're not in a hurtful situation. They can have daydreams or flashbacks. They can actually fully shut down. They may have some memory issues related to when the trauma happened. Some people have had trauma and completely blocked it out, where they don't even remember it, which can be a good thing. But unfortunately, it can mean also that when they're least expecting it, those memories can come back. They can have insomnia, difficulty sleeping, and also hallucinations. They can have these out of body experiences where they're hearing people who were with them during the trauma. They're seeing things that happened to them, and it feels real. They can smell the pit burns from them. Just thinking about veterans and their experiences that they've had, they can sometimes have hallucinations that they're having those experiences in that moment. And so it's really important, if you have a loved one that struggles with PTSD, to know what their triggers are, maybe to have a plan of action if they, have some numbers, of people that they reach out to when they are not doing well or something has happened, so that they have some supports. But it's important that we know, that we can also experience trauma every day in our lives, and that it can affect us just as much as someone who's on the combat field. All right. So psychotic disorders. And so I'm going to talk a little bit about the psychotic disorders. These are some of the symptoms of psychosis. Psychosis it's basically, it affects your senses, it affects your thinking, your cognition, but it's basically, maybe unusually slow movements, like maybe people who are catatonic, they could, become kind of like robot movements. They may have disorganized thinking. You may be talking with someone that has psychosis, and one minute they're talking about their lottery ticket, and the next minute they are, talking about going to space. It's a lot of disorganized thought and speech. So you may think that they're, something's not right because their thoughts aren't connecting. They may be having a psychotic episode. And delusions. Someone who has psychosis may have delusions, false beliefs that they absolutely feel are correct. They feel like these are true. It may be related to, HIV or COVID, but they have this belief that is based not in reality, but they believe it with all of their heart. And it can be a barrier to treatment. If they feel like doctors are giving them medicine to poison them, it's going to affect whether they actually engage in treatment. Paranoia is another specific symptom of psychosis, where they may feel suspicious of people. And it may not be founded in any, real basis, but they just feel like, they have this thread of thoughts that people are out to get them or mean them some harm. They may not have concerned about their hygiene or appearance, so they may look ungroomed or unkempt. And they may also have hallucinations in all their senses. They may smell things that aren't actually there. They may see things. They may hear things. And it's just a disconnect with reality. And a lot of times people who suffer from psychosis do engage in self-medicating behavior, whether it be alcohol or drugs or even tobacco. A lot of times it's a constant smoking behavior that could be self-soothing. So schizophrenia is the main condition that has psychotic features. Um, but there are some others, and there are different types of schizophrenia. I'm not going to go in all the details, but it's just a type of condition where the person really needs a lot of support in order to live independently in the community. But there are people who do live independently in the community with schizophrenia. They may have the help of their family members and friends who just check in with them, provide some support and encouragement. They're going to need some support. But other conditions that also include psychotic symptoms is a brief psychotic episode. Like someone may have a brief episode of psychosis where they don't know why it happened, but they may have psychotic features. They may have these thoughts and this confusion of thought. And then there are some people who actually have this delusion, but it's separate from schizophrenia. It's just this delusion that they have. They believe it with all of their heart, but they don't really have a full psychotic disorder. It's really just that delusional state. And they may be treated with medication for their delusional thinking, and it may help them to, even though they have the thought, they may still be able to, function and not put themselves at any risk based on those delusions. And then substance-induced psychotic disorder is where certain medications, certain drugs, illicit drugs, and I guess prescription medications can also be responsible for a psychotic episode. And so maybe someone had some drugs, illicit drugs that, like PCP, for instance, it can cause psychotic symptoms. And so that would be listed as a psychotic, a substance-induced psychotic condition. But I just want to mention here other conditions that have psychotic symptoms. Someone can have bipolar disorder with psychotic features. So, as well as depression, severe depression with psychotic features. And then someone can be in the midst of a psychotic episode and die by suicide. And that would be psychotic suicide. And so maybe they're, having these thoughts that someone's chasing them and they run into the street. And unfortunately, they die at their own hand, but it's under this influence of this psychotic thought. And also, I always like to include dementia because a lot of times when our elderly folks are suffering with dementia, it can include psychotic thinking. It can include hallucinations. And so sometimes it's hard to tell the difference between a psychotic episode and dementia. And so it's important that you always, even though they may have a mental health provider, it's always important to include your medical doctor as well, to ensure that you're not overlooking something that can be rooted in a medical condition. All right. So moving along to substance use and dependence disorders. I am not going to talk a lot about substance use. We all kind of understand illicit drug use, alcoholism, but I do want to highlight a few things. Alcohol is still the highest, the most abused drug of, well, it's over the counter, it's not regulated as an illicit drug, but it does have a lot of consequences for people who struggle with alcoholism. And so it's important that we really continue to be diligent about alcohol and how people can form a pattern of addiction to alcohol, and it can have lots of consequences. In particular, I always point out with alcohol, it's not the type of substance that you can immediately stop. We think about people and we encourage them to, hey, stop cold turkey. Well, unfortunately, alcohol is one of those symptoms that you want to check in with your doctor if you've been drinking heavily and you are hoping to stop, you want to make sure that you're not in any medical risk, because if you've been drinking heavily and you stop alcohol abruptly, you can have withdrawal symptoms and they can be fatal. And so it's important to, talk with a medical professional. And if you stopped drinking alcohol abruptly and you recognize some symptoms, you want to seek medical attention. I want to just bring attention to the opiate and the fentanyl crisis. Right now, we are in a crisis of opiate overdose as well as fentanyl. And there's multiple types of fentanyl out on the streets. And unfortunately, people aren't aware. They may be interested in opiates, but they may get fentanyl. And fentanyl is probably about 10 to 20 times more dangerous than opiates. I remember hearing a story of a police officer who came to the scene of a fentanyl overdose, and he just touched the substance and was at risk for overdose himself, had to be taken to through emergency services and treated by medical professionals. So if you encounter any pill and you don't know what it is, don't touch it with your bare hands, because fentanyl can be very, very dangerous. And I want to just talk about the cannabis legalization. I think that we're on the precipice of this legalization in the state of Maryland. But we do have to talk about that it is an addictive drug, addictive in the sense that people can become psychologically addicted. They can, it can become something that they prioritize over all else, their family, their career, their, all kinds of social things. So it's important that we be mindful of that and know that there is treatment out there if people want to stop smoking marijuana, that there are some treatment modalities out there like groups and different things like that that can be helpful. Cocaine is another one of choice for unfortunately people abuse, and methamphetamines. But I also wanted to bring attention to something it's in the young adult and teenage population, huffing. And that's something that I like for all parents to be aware of, because there are items in our own house that can be deadly. And so that's where young people use aerosols to actually get high, and they inhale them, and people do die as a result of that. And so it's important for people to know, and also be mindful of, if you got what is it, aerosols, different sprays, and all of a sudden they're all going empty, take note, ask questions. Okay. All right. These are the things I'm going to try to move along quickly, because I don't want us to get to the end without having an opportunity for questions. But these are the things that if you recognize these, it may mean that, maybe that wine that you were having every night is getting to the place where you need to be concerned that you might be crossing over to an abuse or dependence. Maybe you're increasing the use or having cravings more. Maybe you're at work thinking about getting a drink. That would be something to be concerned about. Failing to fulfill your obligations at home, work, or social settings as a result of wanting to abuse or use substances. Using them alone or in a secret setting. So you don't want other people to know. And so it's no longer social, that you're now, hiding it from the people you live with. Minimizing to others how much you use, using despite the consequences or the risk. Maybe for someone that's using illicit drugs, you're running a risk of being arrested and going to jail to get that drug. And so that should indicate that, you may be on your way to more of an addiction. Wanting to cut down or stop, but finding it hard to do so. Taking more in a larger amount. Using despite the dangers it causes, maybe physically to your body as well as social dangers. And changes in your peer group. Maybe that person has changed their whole peer group because now they're hanging out with people who participate in that similar behaviors. So now they have more using friends. And loss of money, valuables, or anyone that's now, borrowing, and that's not typical of them, it'd be something you'd want to be concerned about. And if that's something that you recognize in yourself, you want to probably get some support for. All right. So moving into the eating disorders. Anorexia nervosa is a type of eating disorder where the person is very, really obsessed about what they intake. They're very cautious about eating too many carbs or eating carbs at all. And what happens is they really start to wither away. They may exercise rigorously, and their goal is to stay slim. But the reality is when they see themselves, no matter how thin they are, they see themselves as larger than they are. So it's really kind of similar to body dysmorphic. They see themselves as fat, even though they may be very small and thinning every day. Bulimia nervosa is a different type, similar, same obsession with the weight and what they eat, but they also engage in purging behavior where they may eat and then actually go to eliminate it. And so that behavior can really have a adverse effect on their health. Then when they do want to sustain a meal, it's very difficult because they've been used to that gagging. And unfortunately, then they automatically do, whether they want to or not. And binge eating in and of itself is a disorder. And then last, talking about pica. And this is it's one of those, it's actually a show that was related to this called My Strange Addiction, where people had pica and they would eat strange things. I remember one episode where the young lady would eat pieces of her mattress. And so that's where they eat things that just are not food and should not be eaten. It's something that happens with people who have like autism. Sometimes they may engage in activities where they're eating things that are not edible. And that would be pica. Just a little bit about what an eating disorder may look like. Someone, as I said, exercising excessively, intense fear of gaining weight. Maybe they have unusually large intake of food, or opposite, maybe they have very, very teeny amount of food on their plates. A preoccupation with feeling fat. Their electrolytes are at abnormal levels, sometimes requiring them to be hospitalized. And they have anxiety around eating and avoiding eating food. And they may have special rituals where they sit down with their water, they eat their, certain one thing first, and they have these really controlled rituals related to their food. And then this fixation with their body image, their size or shape, like they're no good unless they're this perfect size and their thighs are smaller, and they're really just judgmental about their bodies. Okay. And then there's the adjustment disorders. And as a private practice clinician, one of the things I really think is important for people to know is that most of the time, the folks that I see who come into counseling are really more in this adjustment disorder area, where I call it this is a Nicoleism, a precondition, where they may be struggling with some symptoms as a result of something that happened in their life. And it's kind of a prelude to a depressive episode or a real episode of anxiety. If they're able to kind of get themselves back on track, connect with their resources, really kind of isolate the adjustment that they're having and improve their functioning, they may not go on to feel that intense depression. There are a lot of other factors, but I just wanted to bring that up because I do think that this is where, for most people, depression starts. It may be after the death of a loved one, a divorce, losing a job, retiring, maybe some academic problems or family issues or money problems. That adjustment can really cause some of these pre-depressive symptoms, like feeling sad, having some hope, having a lack of hope, feeling jittery or nervous. And so it's really an opportunity. I want people to recognize this adjustment area. And so that when they start feeling this way after something happens, they recognize they may need some support. This is really the great time to come connect with your primary care doctor or reach out to a mental health provider for an evaluation, because this is where you recognize that you didn't get that adjustment period didn't go well. Like, that you're having some difficulties, and that's okay. But it's important to reach out for some support. All right. So in closing, I wanted to add this: when supporting someone with mental health issues, just some tips. Be patient with them. They are going through this journey. They don't know what to expect. And so you have to be patient with the individual. Spend time with them and also give them space for, to be alone if they need that. And you can also ask, what do you need from me? Mind your own mental health as a caregiver or a supporter, because it can be challenging. Be sure you put the oxygen on you first. And so that's just reminding us that it's great to be there for someone else, but it can be stressful. And so you have to take care of yourself. Put your oxygen on first, and then you'll be able to support someone else. Remind them of how much they mean to you. Just, remind them they're not their diagnosis. They're struggling with this, but it's not who they are. Just like we wouldn't define them by cancer if they struggled with cancer. They're not their diagnosis. Also, you want to read up on the illness to inform yourself of potential symptoms, triggers, and behaviors so that you know how to support them. But also do that for yourself. If there are things that you're concerned about for you, look into it, find out more information. Offer advice when they ask, listen empathetically when they want to vent. And do not attempt to diagnose them or yourself. It's important to recognize that we need professional help. We wouldn't try to diagnose a tumor. So it would be important that we don't diagnose our mental health issues as well as we don't do our medical issues. And then recommend an evaluation for anyone, including yourself, who's struggling with any of these issues that we discussed today. You can do that with your primary care doctor. You could also, contact a mental health provider and seek to get a evaluation. And that's just basically they'll ask you some questions and really give you some feedback on the things that you've been going through. Okay, in our book and resource corner, we just want to make sure you guys have resources. The mental health hotline by the District of Columbia, that 1-888-793-4357, and it's actually 888-7-WE-HELP. And that's really, you can start getting your support. It has responders available 24/7. You can reach out to get some help if you're struggling and need that help right away. This book is a really great resource too, The Unapologetic Guide to Black Mental Health. And one thing I will say is that it is important to recognize there's a difference. I think that there's stigma in the Black community, and sometimes reaching out for support in the Black community can be very difficult because of that stigma. And this is a great guide to help, families who are struggling to really get more information that's, in a way that relates to our communities and how we deal with mental health and how we should deal with mental health. And then this book also is a great resource. You Need Help. It's a step-by-step plan to convince a loved one to get counseling. And this is a local psychiatrist, Dr. Conrad, who's from Johns Hopkins University. He wrote this book to really be a guide for family members on, or ourselves. You can read it for yourself, but it really talks about how to encourage someone to reach out for support. And ultimately, you can dial 311 in Washington, D.C. They have, you can access their support to their mental health as well as their substance abuse treatment through their 311 system. But also wanted to just make sure people know in a crisis, you can dial 988. And that will help you access immediate support for someone that you care about who's struggling in that moment. That responder on the line is available 24/7. But if that person needs to be, maybe go to the hospital and have an intervention immediately, they're able to support, which is really important because we want to be able to support those when they're in crisis. Another thing I always tell people is sometimes 911 is not the best resource when we're in need of support. And so 988 is a great resource. It can help you because what they will do is send, they may send a mobile crisis team. If that county has a mobile crisis team, 988 is going to reach out to the mobile crisis team first before employing police officers. And sometimes that's just more helpful. So I just wanted to make sure you guys are aware of those resources. All right, we have reached the end, and I'm going to ask if there are any questions. Let's see if we have any on our live stream before we disconnect. I'm going to load it up to see if anyone asked any questions. I don't see any questions as of yet. And our team is here, and I don't think there are any questions at this time. Nope, I don't see any. Well, what I will say is, thank you for your time this evening. I hope this has been informative. If you have questions, you could certainly comment on our live. We will actually follow back up and answer any questions that have been asked on there that we may have missed. But we hope that you will join us. Let me go to my next slide because I want to talk about our next time. Join us next month for our next segment. Mental health is a serious matter. Our series, this is session number 3, Surviving Burnout, How to Recognize Symptoms and Seek Support. We have the wonderful and the expert in the field, Dr. Rosalind Aker Black, who's going to be our speaker for that segment. Please join us Tuesday, July 25th, 2023 at 7 p.m. as we come back to you live to present the Mental Health is a Serious Matter. Because you guys matter, and we want to make sure you have all the information that you need to help yourself and your loved ones. And so, bye-bye for today. Take care.